What is wrong with your spine and why does it hurt so much? In this video, I'm going to give you so much information you will probably know more than your primary care doctor. My name is Dr. Story. I've been a chiropractor for over 24 years. I'm going to give you some realistic advice based on my experience. Back pain, surprisingly, is not a diagnosis. When patients go to a doctor and then they come into me and I say, well, what did the doctor say? And they say, well, I have back pain. I go, I know you have back pain, but what tissue is damaged? They have no idea. Part of rehabbing and really taking control of your own health and controlling your back pain to the point where you almost have it fixed, and in many cases, many forms of back pain can be fixed, but you need to know the tissues that are damaged. That is extremely important. So this video, my goal of this video is to give you so much information that you are well equipped to ask the correct questions when you go to the doctor. So let's cover first the spine. Now, when people think of back pain, they always think of the spine, but there's a lot more that's going on. But let's talk about the spine. There are 5 bones in your lower back. There are 12 bones in the middle part of your back, and there are 7 bones in the neck. Now, how do you remember this? A good way to remember it is that you have breakfast at 7 a.m., lunch at 12 p.m., and dinner at 5 p.m. So 7, 12, 5. In the lower back, you have 5 lumbar vertebrae, and let's talk about that. These are the actual vertebrae. Now, I want you to think of the vertebrae as concrete blocks, because essentially that is what they're made of. They're made of calcium and other minerals, and these bones are hard as a rock, and they're pretty much square. In between the bones are the spinal discs. Think of the discs as like jelly donuts, very strong jelly donuts, so that each bone can communicate with another bone without grinding one another. So what ends up happening is when you bend, these spinal discs, or the jelly donuts, actually have some cushion to them. Now, if you turn the spine around, you will see that there are these bumps on the back sides of the spine. Those are things that you can actually feel yourself. So when you feel behind your back and you go back there and you could feel those bumps, you are feeling the back of the vertebrae. Now, between the back of the vertebrae and the front of the vertebrae are what are called facet joints. And I drew right there, let me get a pen. Right there, I drew some black so that I could show patients. Let me get up close here. And let's see if we can focus on that. Okay, just right there. And those facet joints are very often a source of pain. But those facet joints are just like your shoulder or your knee or your hip, but they are joints where they slide like this. So they slide back and forth, and they slide up and down. And what those facet joints, along with the disc, allow the vertebrae to move back and forth. Now, in between the 2 bones, right there, that yellow thing is a nerve. Now, that nerve goes from whatever tissue it wants to go to, goes into the spine, up to the brain, and gives communication to the brain to let your brain know what's going on in the environment. Those are called afferent nerves. Then, within this same housing, when your brain wants to tell a muscle, for example, how to function, it sends an impulse down through the spine, or the spinal cord, and comes out and goes to wherever that muscle is. That's called an efferent nerve. Now, what you don't see here, and we're just talking about the lumbar spine, is how is this all connected? It's connected through soft tissue, meaning ligament tissue, fascia, but the most important are ligaments. Ligaments are like rubber bands that hold everything together. And so if you were to bend to the side, there's a natural tendency, if there are rubber bands on this side, to kind of pull itself back so that you don't have to expend a lot of energy restoring good posture. In addition to the ligaments, you also have muscle. Now muscle, I want you to think of muscle as like steak, because that's actually what muscle is. If you were to eat red meat, you are eating the muscle of whatever animal you're eating. And the muscle is on each side of the spine, and it's thick, just like a steak. Think of it like a raw steak though, not a cooked steak. So it's red, it's got lots of blood in it. And so what the muscles do is they allow and can control movement of your spine. So if I want to twist my spine like this, how it works is my brain sends an impulse down through the nerve, the efferent nerve, to the muscles, and then the muscles will contract in order to turn me. That's how it works. Now, let's talk about why you're hurting and how to know the difference. Here's the key. You have to know which of those tissues is actually the cause of your pain. Is it the bone? Is it the joints, the facet joints, those things that slide? Is it the ligaments? The ligaments are, remember, rubber bands. Is it the disc, the jelly donut in between the two bones? Or is it the muscle? So, it's important when you have back pain to not just say that you have back pain, but to actually say, I have back pain that's caused from the following tissues. Now let me give you some clues as to how to know which one it is. Bone pain is usually caused from some type of injury, and usually there's a trauma. And very often there's a deep, boring type of pain. If you had a compression fracture of the spine, if you had what's called kissing spine, where the two bones come together, it's very much like a deep, boring type of gnawing ache. That's usually what bone pain feels like. If you had a disease of the bone, such as cancer, you would have a dull, achy, boring type of deep pain in the bone. Now, if it's a musculoskeletal type of pain, where it's like a compression fracture, it would hurt upon movement. But if it's a cancer, that can hurt no matter what type of movement you have. Now let's talk about another cause of back pain, the facets. The facets are an extremely common problem and an extremely common cause of pain. And it's a shame that people don't know this, but that's the way it goes. Facet pain is usually going to occur, especially if you bend backwards. So one of the tests that I do, and I'm going to put a link down below of an example of how I treated a patient and cured this patient of facet syndrome. So I'll put that in the link down below. But essentially, if you have the patient bend backwards and arch backwards and lean to one side or lean to the other, what you're doing is you're testing the actual ability of the facets to slide. So what you're doing is you're essentially taking those joints and saying, slide for me this way, and then slide for me this way. If it causes pain, very often it can cause anything from a sharp stabbing pain, when it's really bad, to a surface area type of dull ache, and it's usually on one side more than the other. It's extremely common in pregnancy as well as being obese. So that's your facet pain. Now, let's talk about the dreaded disc. So there are many different causes or types of disc problems. I'm going to talk about 3. One of the most overlooked is an internal disc derangement. I believe I have some other videos on this. I'll put the links down below if I have them. I know that I do. Just if I forgot to put the links, by the way, let me know in the comments section and I'll get them to you. But an internal disc derangement is basically like a severe sprained ankle, but it's inside the disc, right there. And usually the telltale sign when a patient walks into the office is usually they're leaned to the side and the pain is usually on the opposite side. So if I'm leaning to the left, my pain is on the right. The patient will very often have a difficult time bending forward. In fact, usually they get to about 15 degrees and that is it. That's as far as they can go. Usually it's because they did something the day before. Internal disc derangements will very often take about 24 hours to essentially swell inside the disc. MRI findings sometimes will be negative because what they're looking for is a disc herniation, which is that. But we're going to talk about that in a minute. But the internal disc derangement, usually I can have these things fixed before you even get the MRI. So internal disc derangements we have very good success with, but it's essentially a sprain on the inside of the disc, thus called internal disc, and the fibers of the disc are deranged. Now let's talk about a herniated disc. This is common. You hear about this a lot, and you can see right there that little red spot. Think of that as like a huge, ugly pimple that came from the inside of the disc where the jelly of the jelly donut squirted out and pushed pressure on the outside of the jelly donut. The problem now is you are getting nerve pain. And so one of the challenges with this is that it pinches the yellow thing, the nerve. So very often you will lose sensation where that nerve comes from. So if those nerves go down into your toes, you will very often have lack of feeling or tingling or burning on the toes. That's the afferent nerves. The second thing is you will usually have some type of muscle weakness. That's the efferent nerves. And with all of these problems, very often if it irritates the nerve, the body isn't stupid. It knows you have an injury here, so very often it will spasm all the muscles. That is to protect you. That is important to understand, that the muscle spasm is not the disease. The actual herniated disc is the cause, but the body is spasming to protect it, and we'll talk more about that later. But the disc herniation sometimes can be managed conservatively. I'm going to say 97% of the time. In our particular clinic, about 97% of all disc herniations that we see, we're able to manage and help and very often cure in the office without surgery. Sometimes the disc herniations are so huge that they just need surgery. There's nothing you could do. Now, on a side note, I just had a patient. It was incredible. He had probably one of the best disc herniations I've ever seen. That thing was so bad on the MRI. The thing literally broke off and leaked down into the segment below and was pinching nerves. He had trouble walking. He had drop foot, and we sent him to a surgeon, and the surgeon actually said, why don't you try conservative treatment or continue, because we saw him for about a month and he was maybe 50% better after a month, which is a good sign. And then the surgeon said, why don't you consider doing more conservative treatment? Within 4 months, the thing was completely healed. He had no pain and was able to go back to his karate training, which is maybe not advised, right? So, but nonetheless, that's a disc herniation. The third type of disc problem would be a degenerated disc. And that's where the disc material has essentially dehydrated. Remember, a disc is like a jelly donut. But imagine if you put that jelly donut out into the sun and let it totally dry up. It's not going to allow as much function and not as much cushion when you bend your spine. How do you know you have this? Well, first of all, usually you're older. Second, usually the pain is really not a pain, but rather a stiffness, particularly during flexion or bending forward. So people with degenerated discs very often just feel stiffness when they bend forward. Also, a degenerated disc usually kind of loosens up as the day goes on. So the patient will usually say their back is kind of stiff in the morning, and then as the day goes on, it kind of loosens up. Now, the last thing that we're going to discuss in terms of pain would be ligament pain as well as muscular pain. Now, ligament pain, it's very difficult to determine if you have that without an exam by a professional like a doctor of chiropractic, someone who specializes in conservative treatment of spines. But the muscular pain very often is very confusing to people because almost every patient comes in and says, well, I have a muscle spasm. Muscles rarely spasm for no reason. For example, if you take my bicep here, I wouldn't just wake up in the morning and all of a sudden my bicep is just tightening up for no apparent reason. Muscles don't spasm for no reason. They spasm for a reason, and most of the time it's protection. Now, there are some rare things where you could be deficient in magnesium. There's various chemical imbalances that can occur. But when muscles spasm, it's usually protective of some other problem, something I just mentioned. However, muscles can be very painful when they spasm. And so a source of your pain can very well be a muscular component. So when muscles spasm for long periods, even after you have solved the other issues, such as the disc problem, the facet syndrome, the internal disc derangement, those sorts of things, you may actually have muscle pain and in the form of trigger points. And how do you know if you have these? Well, usually it will limit range of motion. So in other words, if you bend to the side or bend to another side and you're not getting severe sharp stabbing pain and you're not getting pain radiating down the leg, it's just limiting your range of motion and feels stiff in the muscle. Very often that is called a trigger point. And think of a trigger point as a little area within the muscle that's actually spasming on its own. And those can be remedied very easily through a treatment called trigger point therapy, which is something we do in our office. And it essentially allows us to find those areas where the muscle is tight, apply pressure with our thumb, that's the way I like to do it, with my thumb, and we would stretch the muscle through a range of motion as we apply pressure to the thumb. It's very often called active release technique or myofascial pain treatment, myofascial therapy. There's many names and everybody tries to reinvent the wheel and essentially name it after themselves and try to trademark it, but for the most part, they're all pretty much the same. If you can treat the muscle, very often you will get some relief, but you must always search deeper because muscles very often are neurologically contracting as a protective mechanism. So if you go to a doctor and they say, well, you have muscle spasm, that doctor needs to look further as to why you're having that muscle spasm. So I hope this has been informative to you. Again, like I said, if you were to learn this information, you know more than a lot of doctors do when it comes to spinal biomechanics. So that was my goal in doing this video. So if you like my videos, give me a thumbs up, subscribe to the channel, hit that bell notification to get notifications that new videos are coming out. I really hope this has benefited you.